Can you see my screen?
Yeah.
Okay, then we will start for today's session. Hello everyone, I'm Sanchika. I'm from Eco India. Today we all have gathered here for the 7th session in the webinar series, which is organized in collaboration with Eco India and Sipher and RCTC PGI-MER. So today the topic is a multi-sectoral engagement for effective tobacco control experience from the state of Himachal Pradesh in India. We have a chief guest, Dr. Gopal Krishna Pal, Executive Director and CEO, AIIMs Patna, have joined with us today. A very warm welcome to you, sir. And our subject matter expert, Dr. Gopal Chauhan, State Program Officer, NTCP, Government of Himachal Pradesh, has also joined with us today. A very warm welcome to you, sir, also. Now we request Mr. Arun Verma, who is the Director of Finance and Operations in Sipher, for the welcome address.
Thank you, Dr. Sanchika. I am Arun Verma from Team Sipher. I am extremely delighted to welcome our chief guest, Dr. Gopal Krishna Pal, who is an Executive Director and CEO, All India Institute of Medical Sciences, and the presenter, Dr. Gopal Chauhan, State Program Officer, National Tobacco Control Program, Government of Himachal Pradesh. I also welcome Dr. Rakesh Gupta, President Sipher, Professor Sonu Goyal, who is a Director, Resource Center of Tobacco Control, PGMR, Chandigarh. I welcome also Dr. Rajiv Chaudhary, Mr. Rajiv Chaudhary, who is a Project Coordinator for ERCTC. I also welcome Dr. Sanchika Gupta, who is a Manager, Project Eco India, and our eminent participants and public health students. Regarding the Strategic Institute, I wish to share with you that the Sipher was established way back in 2018 with the fundamental purpose of creating a specialized public health workforce that can plan, execute, and monitor national health program and public health initiatives for checking emerging public health challenges. We have been working on all public health issues with a special focus on non-communicable diseases. In the last about 5 years period, we have organized more than, rather close to 100 physical as well as virtual workshop consultations. We have been working in collaboration with the ERCTC, the Resource Center for Tobacco Control, a joint venture initiative of the PGMR Chandigarh and the Union, is emerging as one of the most sought after platforms that showcase tobacco control initiatives, updates, policies, resource materials, etc. from the length and breadth of the country. It has helped in strengthening the National Control Program and TPC to a great extent. Once again, I welcome each and everyone to this seminar. Over to Dr. Sanchika Gupta.
Thank you, sir. Now, I would request Professor Sonu Goyal, who has joined with us today for a discussion on objectives of the consultation. Over to you, sir.
Right. Thank you, Sanchita, and thank you, Dr. Rakesh, for inviting me. First of all, I am thankful to AIIMS Patna Director, Dr. G.K. Pal, who has kindly consented to be a part of this discussion and chairing this very important webinar. So I can say that this webinar will be very useful for our delegates here, because this webinar is coming directly from what we say horse mouth, no? So directly coming from the person who has implemented the things in the field. This is number one. And number two, the USP of this webinar lies in the fact that we always say that multi-stakeholders, unless we involve different stakeholders at one for a cause, we may not be able to achieve our objective, because all of you are working in field in various states, and you might have observed that if you don't work in collaboration, the things will be not that. So Dr. Gopal has worked in that capacity, and Himachal, we always emulate that Himachal is one of the states who has been doing very good, has been a leader in tobacco control, and Dr. Gopal Chauhan has from front there as a national tobacco control officer, and also he's handling, if I believe, at that point of time he was handling 13 national programs there. So it will be really useful. So I am not, I will not come in between the discussions of Dr. Gopal Chauhan and you. So I invite Dr. Gopal Chauhan. But before that, before inviting Dr. Gopal, I may request Dr. Sanchita to invite Dr. G.K. Pal to say a few words about this series and about tobacco.
Sure, sir. Sure, sir. Give me a second.
Dr. Sanchika, you can even
Yes, yes, sir.
click a snapshot. Since
Sure.
everyone with us, Dr. Soni is with us, and Dr. Pal is with us.
Sure,
So
sir.
may I request all to please switch on the videos. Dr. Susan, Miss Susan, can you please switch on the video? Sushma, Narendra Pal.
Aruna
Mary
is
Rai.
there, I think. Dr.
Yeah.
Aruna is there.
Yeah, sir, we'll just have a snapshot and then you can please address us.
Very good afternoon, all of you, and namaskar, greetings from AIIMS Patna. I'm indeed delighted to be part of this program, and thank you so much for inviting me for this special webinar. So my special thanks to Rakesh Gupta ji, who was instrumental in inviting me for this program, and I especially thank Dr. Sanu Goyal, the head of the Department of Community Medicine of PGI Chandigarh, who has been instrumental actually doing so much on the tobacco control. On 18th, we had a beautiful program organized at NAMS under the leadership of Dr. Sanu Goyal, and we had formed a national consortium for the tobacco control. It was a beautiful program, and I am sure that such programs should be conducted regularly. The webinar which is being conducted today, and my special thanks also to Arun Verma-ji, the Director of Finance and Operation, who gave the introductory remarks today for this program. This tobacco control is highly essential because tobacco menace is such a major problem of socio-cultural problem. This is a problem of economy and also the health problem of the country. Therefore, and it affects almost all ages, starting from the young adolescent to the old age. Our days, actually, when I was a student in the school, those days actually the tobacco control was not in the mind of any policymakers, because tobacco use was not a menace, but it is actually a menace, and therefore the control and elimination of tobacco use has become high priority of the government. So today we have actually a distinguished guest speaker, Dr. Gopal Chauhan, who has expertise in this, and he is the real experienced person, and we will be listening to him. And therefore, I will not take much time, and I invite the speaker to make a presentation, and maybe after that we can have a discussion. Thank you all.
Thank you, Dr. Pal, for the inaugural address. So I'll request you to just stay for some time, because Dr. Gopal Chauhan is a very learned person, and he's one of the best state nodal officers in India. So multi-stakeholder involvement, he'll be telling you about his own personal experience. So thanks.
I'll attend the program, sir. I'll attend the program fully.
Okay. Thank you. Thank you.
Here, just give me a second. I will reshare the slides. Can you see my slides? Can someone tell me?
Yes, we can see you.
Okay. Now I would request Dr. Gopal Chauhan for his presentation on the topic, and also I would like to introduce Dr. Chauhan. He's an implementing and integrated digital approach for NCD prevention and control. He's a technical resource person for NCD tobacco
Sanchita,
control.
I would like to stop you because much has been told.
Sure,
I
sir.
don't think that we should go for such kind of introduction here. You can directly go to the presentation. I am sorry to interrupt you because, I am having in this panel my teacher, Professor Sonu Goel with us. And, my senior, Dr. Kesh Gupta. I think we should directly move to the presentation if Chair and Chief Guest allows.
Yes, you may, sir. You may proceed, please.
Thank you, sir. Thank you, Sipher. Am I audible clearly? Okay, thank you.
Yeah, you are audible. You are audible.
First of all, thank you, Chair, the chief guest for today's program, Dr. Gopal Krishnan Paul. He is a very, eminent researcher, and he is at top right now. He is the ED, and I think that this is the best opportunity that to showcase that what is happening and what should what should be our program and plan. So that, for me, it will be more of a learning experience rather than sharing. But really, sir, I thank you for, sparing your time for this, very important webinar today and giving me the opportunity. Second, Professor Sonu Goel is my teacher, and he said few words about me. And I think that most of the teachers used to say such things about their students. And I take these things, in a very kind, manner. Then Dr. Kesh Gupta, yes, we have been struggling together since beginning for tobacco control, and thanks to the entire Sipher team. My job is, to tell to the audience today, we are having a very good number. Generally people, they don't participate in such webinars in large numbers. We are having 63 participants as of now, and the number is likely to increase. I am receiving calls from, my district and other states also, that they might be facing some problem in connecting. But, I think with passage of time, the number is, growing up, and we expect to touch, 100 today. My topic is, to talk about the multi-stakeholder engagement for tobacco control, rather effective tobacco control. First of all, we need to understand that what do you mean by stakeholder? Stakeholder in simple term is whosoever are involved or whosoever are affected. For example, the individuals, the communities, the government, the departments, they are all stakeholders, NGOs, governments. And what can be done for the best outcomes as far as tobacco control is concerned? That what can we do collectively, that is a multi-stakeholder engagement, so as to produce good results, so as to end this tobacco menace, so that generations to come can say that the tobacco is history. There was a product in this century known as tobacco, which was killing so many people around the world. I think with the note, I start my presentation. This is brief about Himachal Pradesh, because I will be talking about my state, that what has happened in Himachal Pradesh so far. We are a small state, and we are having a population of around 7 million. It is a hilly state, and it is a famous tourist destination. And the challenge is that, we are getting threefold of our population tourist inflow every year. And there is likely that, chances that there might be plenty of violations like in other tourist destinations. Next, please. Yes, I used to repeat this slide, I think, everywhere, that why there is need for tobacco control. And you all know that, these things are important, and these things. But, as a repetition, I would like to say that tobacco causes diseases. It is a gateway for addiction. User want to tobacco it, quit it. Passive smoking is quite harmful. And as per the Constitution of India, we are having a right for fresh air, and health expenditure on tobacco-related diseases threefold the revenue which is earned from tobacco. It means that it is a useless product. It is not having any gain, you may say, to the government as well as to the individual. There are only, harms of tobacco everywhere, except for the tobacco industry or the people, those who are involved in business of tobacco. Otherwise, every person is affected due to tobacco. Next, please. Yes, if we talk about the tobacco control policies at global, national, sub-national, and local level, we are having plenty of policies, laws, programs. For example, we are having a national health policy. It is very clearly written in the policy that what should be the tobacco use by this year as a mandate of this policy. You know that the policy introduction for health in India is to achieve the Sustainable Development Goals. And in the Sustainable Development Goals, we are having clear-cut targets that what has to be done by 2025 and 2030. Then we are having at global level the Framework Convention for Tobacco Control, Empower Policies, National Tobacco Control Program, Tobacco Control Act, which we call popularly as COTPA, and the Smokeless Tobacco is covered under Food Safety Standard Act. We are having Drug and Cosmetic Act, PECA for electronic cigarette, Juvenile Justice Act, Vendor License Act, and Municipalities Act at various levels. It means we are having multiple legislation by which we can control tobacco. Thank you. Next, please. Yes, coming specifically to the Indian context, we will be talking about two things here. One is Tobacco Control Program and Tobacco Control Law. Tobacco Control Law is, you might be knowing in the previous webinar is explained, by Dr. Amit Yadav very nicely that what are the sections, why there was need for law. I think that there is no need for repetition. Next, please. Yes, very importantly, this should be repeated in, I think, in each and every webinar. The tobacco control legislation focuses mainly on four things. One is smoking ban in public places, section 4. Ban on sale of tobacco products to the minors and by the minors and around schools, section 6. And ban on direct and indirect advertisement of tobacco, section 5. And ban on sale of tobacco products without pack warning, section 7. But if we see that in order to implement this law, the protection is given to the law enforcers that no prosecution can be launched if anything is done in good faith, meaning thereby, if the person has cut a wrong challan by mistake and court proves that the challan was wrong, there shall not be any prosecution against the law enforcer. Next, please. Yes, in my state, the tobacco use burden was very high, as per the National Family Health Survey 3, as well as if you know the GATS 1. Next, please. The common causes were, it is highly socially accepted like in other parts of the country, and it was a status symbol because Himachal, Shimla was the capital of India during British rule from 1864 onward. And you know that it was a status symbol to go to the famous places and, to wear that long coat and hat and, to use that cigarette smoking as a symbol of status that, the high class people used to smoke. And, the people down the lane, youngster and, most of the people, they used to follow the Britishers for cigarette smoking. And we started tobacco control in the year 2007-8. And always saying that tobacco control in Himachal Pradesh is not only a government initiative, it is a NGO initiative which was supported by the government. Initially, it is a NGO move and it has been supported by the government. It is a NGO partnership. And after sensitization of the key stakeholders, administrator, politicians, by the NGO and this collaboration with the government, then the state level committees, the district level committees and sub-district level committees were formed for reviewing, monitoring and enforcing tobacco control programs as well as the laws. And then, there was a strategic plan which was developed by the state based on the experience year-wise evaluation that what can be done and where are the gaps, who are the people, those who has to be identified, and how to take tobacco control further. Next, please. We started it in 2009, where the first meeting was held under the chairmanship of the chief secretary, for all secretaries, so that, the biggest gap was in multi-stakeholder engagement. That was that the departments were working in isolations. For example, the education departments, the police department, the health department, we brought all two departments together in this first meeting as a multi-stakeholder meeting on 5th of May 2009. Next, please. Then we started it in a campaign mode, the celebration of the World No Tobacco Day. Next, please. Keep on sliding because these are just photographs. Then we tried to declare Shimla as the smoke-free city. We did a survey in Shimla. We did the baseline assessment. We mapped the institutions that who are going to help us. Yes, we found that 97% people were, of the opinion that they wanted to support us, and it was a good initiative. And within a period of 1 year, we could declare Shimla as the first smoke-free city, which was evidence-based in the state. And I think overall, it is the third in the country. And evidence-based, it is the first. As on today, each and every jurisdiction in India, which is being declared as smoke-free, are following the Himachal model for smoke-free. Next, please. This is the certificate. Now, each and every district or sub-district level, this certificate is being used with some modifications. Next, please. Yes. What we did in order to institutionalize the mechanism with multi-stakeholder engagement, we notified the flying squads. Because there was a big issue in enforcement, multiple enforcement officers has been authorized. And we made a list that whosoever from police, excise, food, health, even NGO people, they should be part of this squad, and we should go as a team for enforcement so that the good results are seen. And I think we were quite optimistic at that time, and the results were in our favor. We also notified the courts because many people were saying that where to put the challans. However, the number of challaning, the number of court cases are declined with passage of time because now we are training the law enforcers very nicely. Next, please. Yes, after challaning under section 4 and 6, we went for section 5 and 7, and we found that we prepared the mechanism. And after that, we found that the convictions are, quite possible under section 5 and 7 in Himachal Pradesh. We launched the first prosecutions under section 5 and 7 in the country. And we saw the convictions from the court through imprisonment and fine to the offenders. Next, please. Yes, what we did, we monitor tobacco control and tobacco use in the state through our own internal mechanism. That what is the level of compliance in 2012, 13, 14, 15, then the GATS came in, and we are doing regular monitoring of tobacco control policies as well as the tobacco use in the state, so that we can say that, how effective the policies are and how the use is going down. Next, please. We declared the entire state of Himachal Pradesh smoke-free in 2013 based on the compliance assessment study. Next, please. We rewarded each and every organization, individuals, departments, those who were contributing for tobacco control. It was not that, we said that it is the health department initiative. We recognize each and every individual or organization, those who were contributing for tobacco control. Next, please. Yes, then the time came when one of the villagers declared their village as tobacco free, that there will be no use, no entry, no sale of tobacco products. And I think this was the first tobacco free village in India, but we could not, publish this. And after that, there was assessment in northeastern state, I think in Mizoram or Manipur, and they declared their village as the first tobacco free village in India. Next, please. Next, the villages were awarded by the Chief Minister. Next, please. Next. You can see there is a continued violation reporting and enforcement. And what is the beauty of the state? That is, we are using the amount collected as fine for tobacco. It means that if we don't have funds for NTCP by the government of India as well as from the state government, but we are using this fund which is being collected as fine for tobacco control only, for IC activities, for for general kind of meetings, and for enforcement. When the squads are going in vehicle, we are putting the fuel and fuel from this tobacco challan money in the vehicles, those who are going for raids, search and seizures. Next, please. Now, the result came when the GATS 2 report came. There was a decline in tobacco use overall in the state. It came down from around from 22% to 16%. The best part was the tobacco use, the passive smoking at home, which came down from 82% to 33%. It means that when we stopped smoking in public places, there was a direct impact on the houses also. The tobacco use at home, the passive smoking went down drastically, which is also a case study in itself that, the ban on smoking in public places reduces the passive smoking at home also. Next, please. This is the GATS 2 result. Next. Yes. When the GYTS report, because many people say that, GATS data may not be so reliable, NFHS data may not be reliable, but we are saying as public health person that this data is quite reliable. They questioned us, but when the GYTS report came in 2021, which were 19 data, then Himachal was having the lowest prevalence of tobacco use among youth. It means that our school-based tobacco control program was quite effective, and only 1.1% students of 13 to 15 year age group that were using tobacco. This indicator says that the tobacco control interventions are working in the state, and this is the low-hanging fruit. If we can stop these students, then in future they will not turning into tobacco user or multiple substance users. Next, please. We are adopting the Govt of India tobacco-free education institution guidelines with state-specific modification. We are having a third-party assessment for declaration of school as tobacco-free. Next, please. Then we are having a state-specific initiative that a tobacco-free Panchayat reward scheme. If the Panchayat is declared tobacco-free on scientific method, which is our protocol, then the Panchayat is rewarded as 5 lakh cash prize by the state government. Next, please. Yes. The summary of the actions is we are having the monitoring committees, we are having enforcement squads, we are having special courts for tobacco violation, we are using the fund which is collected as fine for tobacco control, for tobacco control activities, and there is a ban on ends. The Panchayats has passed a resolution for supporting tobacco control. We have authorized the NGOs to issue notices to the violators before enforcement, and we have notified the protocol for 5.3 article. We are having the state specific legislation for tobacco vendor licensing and to ban sale of single cigarette. We are having 100 tobacco station centers as of now. We call them Naindisha Kendras. We are having our state specific guidelines for tobacco free education institutions, tobacco free panchayats, and health promoting education institutions. And we have notified a committee, which is a health promotion committee, which talks about all the health regulatory issues in a comprehensive way by involving all the related departments. And in the end, the tobacco free panchayat scheme. Next, please. Yes, I have already explained that what we are doing in Empowers. We are, touching each and every component of Empower policies. Next, please. And we have been awarded, the state has been awarded by this year on World No Tobacco Day by the WHO as a special recognition award, on the World No Tobacco Day. Next, please. Yes, we are having a very definite targets that what should be the tobacco use by which year, so that we modify our protocol, we redefine our strategies. For example, few strategies may not work, few are working, and we have the every possibilities that we have to change the strategies. For example, I am telling you in 2010 the tobacco use was 22%, which came down to 16% in 2016. As of now, the tobacco use is 11.6% among adults, and our target is to reduce it below 10% by 2025. And by 2030, we are able to target to reduce it below 5%. It means the entire state is working to achieve this target. And after that, if we go below 5%, then we can say that we are going for tobacco end game in the state of Himachal Pradesh. Next, please. Now, talking about the multi-stakeholder engagements, if we talk, we are having different ministries which are involved in tobacco-related issues, directly or indirectly. Mainly Department of Health, because tobacco causes diseases. Home Affairs, because it is a regulatory issue, the police persons are involved. It is illicit trade issue, they are involved. Department of Finance, because it is also a commercial issue, it is being sold. The GST is levied on tobacco products. It is a crop. Food Processing Ministry, Education Ministry, Law and Justice, Environment, because tobacco causes a lot of environmental hazards. Forest, climate is affected, and then it is also trade and commerce. It means that they are the stakeholder ministries which need to be taken into loop when you are designing, drafting, or advocating any tobacco control policies. It means that I am saying that still it has not happened. All these ministries should be the part of the state level coordination committee and the national level coordination committee, so that a concrete solution for tobacco control can be made, because many of the ministries are not part of the state level coordination committee and the national level coordination committee. Next, please. Now, the role and responsibility of the various ministries. I have already explained. The key role which should be given to the health department is health promotion and surveillance. To the home ministry, it should be given the enforcement. Finance ministry should be advocated that you should add, taxes which are more than the GST, maybe indirect taxes. You can enter the certain your taxes by the states also. We are also advocating for that. We are advocating in the state that we should levy a tax over and above the GST. We are trying to explore the possibilities. Agriculture, we need to regulate the production and food processing, food packaging. Education and DPR department doing IECs, law and justice, lawmaking. Forest department restricting cultivation, and trade and commerce to curb the illicit trade. And then definitely there is role of excise department about the entry of the tobacco products. Next, please. Yes, if we involve all those ministries, then we can redefine our flying squads, the role of the academic institutions for the compliance assessment to tell us that what has happened in the jurisdiction, maybe at national level, below national, and at national level, that what has worked, what has not worked. There is a definite role of academic institutions, and rest I have already explained that what the role of ministries should be. Next, please. Now there is also a scope within the different programs. I told about the ministries, but within the different programs which are being run under health systems, there is always scope. For example, there is a program, National Tobacco Control Program. The tobacco control program is integrated with TB control program also. It is also related to other programs. It is related to the Rashtriya Bal Swasthya Karyakram, Rashtriya Kishore Swasthya Karyakram, NCD program, because it is a risk factor for NCD, elderly program, and oral health program, reproductive and maternal health program, because it causes abortion also. It causes multiple defects to the to the baby. And national mental health program, because it leads to addiction, and then the patient has to be admitted in the psychiatry ward many of time. And multiple regulations are also there. I call them also the stakeholders, because we are talking about tobacco control law, but we have to implement the Food Safety Standard Act, Juvenile Justice Act, human right, it is also human right for smoker as well as for non-smoker. The smoker may say that it's my human right to consume tobacco, but the non-smoker is having a human right for fresh air. There is a conflict of interest. And if there is a conflict of interest, as per the Article 47 of the Constitution of India, the interest in good health shall always prevail. Then Poisons Act, Municipality Act, and Public Nuisance Act. And last but not the least, the most important, the Indian Penal Code, the IPC. It means that tobacco is definitely a multi-stakeholder gamble. It involves various ministries, various departments, various programs, various laws, various acts. Next, please. The challenges which we all face, the biggest challenge is tobacco industry. The second challenge is we are having huge number of tobacco users. If we stop tobacco today, that this is totally banned, they will cry because we don't have the tobacco cessation facilities. This is the best way that goes slowly and steadily, make a target, maybe by 2030, that by which year we will reduce the prevalence, the active smoking, passive smoking, and then there will be a small number which we can address to tobacco cessation very effectively. Then we have to go for alternate livelihood to the farmers and the traders also, because they are also our brother and sister, those who are selling tobacco. We need to tell them that don't sell this product, you go for alternate business. The farmers are also our part. They are also, it is the bread and butter for the farmers. They may not be knowing that this is a harmful product, but we need to tell them that this is alternate crop and please stop, doing the cultivation of this product. Newer products, there are challenges. For example, the e-cigarette, hookah bar, chotu, the gutka part, and there are definitely limitations in the law. Yes, the newer products are being addressed through these webinars, through capacity building exercises, by new legislation by Govt of India as well as by the state. But the challenges will be, more challenges will be coming up, because when we were banning smoking in public places, they came up with the electronic cigarette. When we banned the smokeless tobacco, they came with two pouches. They will definitely struggle, because I know that tobacco industry is a dying industry. They will do something, before dying, and we have to struggle, we have to fight. And the limitation of the legislation, definitely they are there. But we are going for at national level for amendment of the law, and I think that the limitation of the law will be overcome. Next, please. The conclusion and the recommendation: tobacco control definitely involves multiple stakeholders. Innovative approaches and financing at local level is needed to sustain tobacco control. What has happened in few states, few jurisdictions, there is a good nodal officer. But if it's transferred, the tobacco control goes into silos. If the political party changes, then for sustaining tobacco control, we need to develop an institutional mechanism. A robust monitoring system should be there, so that you tell that as on today, tobacco use is this much. As on today, law enforcement percentage is this much, so that you can tell that this is going down, this is going up. Last but not the least, we should prepare a state-specific plan and strategies to achieve tobacco endgame, so that we can say that by 2023, the tobacco use should be this much. 2025, tobacco use should be this much. By 2030, this should be our target, so that every government, every stakeholder works together, to achieve those targets. I think I will stop here. Thank you very much for your patience listening.
Thank you, sir, for an excellent presentation. Now I would request Dr. Rakesh, sir, for the Q&A session. We see there are many questions in the chat box.
Before
there are
that,
many questions,
Dr.
then I
Sanchita,
say
just
that,
request
I
a
could
brief
not
comment.
answer the queries. I think the presentation might have some limitations.
Before going in for question and answer session, we'll ask our chief guest to give his brief comments on your presentation. So, Dr. Pal, please.
Thank you so much. Thank you for a brilliant presentation by Dr. Gopal Chauhan. I was attending it very attentively, so well spoken. Thank you, sir. It was a very nice presentation and very useful presentation. I'm sure the entire audience has been highly benefited. There may be a few questions, and those questions can be addressed. Sir, if the questions are available and can be given to him, and someone can read out, and then he can answer the questions.
Yeah, and before that, we have some stalwarts with us, tobacco control stalwarts. So we'll be asking for their brief comments also. So thank you, Dr. Paul. Thank you, sir. So may I ask Dr. Rakesh Gupta from Jaipur? He has joined us. So his brief comments on the presentation, please. After that, I may call Ms. Susan. So Dr. Rakesh Gupta, are you with us, sir? Or Ms. Susan?
Anji sir, good evening.
Yeah. Your brief comments.
See, Sir, I've been an admirer of Dr. Gopal Chauhan's work ever since I have been in tobacco control. I specifically wanted to comment on Section 5 initiatives, and that's where we also learned and followed up a lot of things from him way back, when they used to get the hoardings from the shops removed and stuff like that. And then we followed up that in Gujarat also in one of our projects. So I believe that Section 5 and Section 7 is not an easy thing to follow up, but I saw that there's a lot of action taken in terms of even the court giving its verdict kind of a thing. So that is something commendable, and I would appreciate that work by Dr. Gopal Chauhan. Rest, I always believe that I look forward to all the initiatives that are taken, or the newer initiatives that are taken, and replicate the same in Gujarat in all our capacities that we can. So thank you so much. Thank you, sir. Yeah.
So is Dr. Rakesh Gupta now available? If not, then Binoy Matthew can ask the questions he has put as in the chat. So Binoy, can you please ask the questions yourself?
Thank you, sir. First of all, I would like to thank Dr. Gopal, sir, for a wonderful presentation. He's an administration for all of us, since, I've been in the tobacco control for the last 14 years, and, talking to him, getting, ideas and how the Himachal Pradesh as a state has adopted this, and Shimla being the city as, when we saw that smoke-free city, it has been a best practice model, and that's the thing, that is going to other states also. So whenever we are working in the state levels, we get, ideas how we can do that. So coming to that, sir, I have just 2-3 things, like, now the Cigarettes and Other Tobacco Products Act is the 20 years old act. So now going forward, what is your take on it? What all things we can do, or how we can go ahead, moving forward? One thing is that. Second, sir, I would like to also know that, as you have rightly shared that, how the state is utilizing the amount for the tobacco control activities, the amount which is collected through challans. So how one thing, because we are being like, we are working in UP, we are working in Chhattisgarh. So how the challan, the amount is collected, where it is being deposited, and how that amount has been utilized for the TC activities. So these are the 2 things I like to know from you, sir. And once again, thank you so much for the wonderful presentation, sir. It's been inspiring to see the good work that you are doing, sir. Thank you.
Thank you, Binoy. Sanchika, can I answer these questions?
Yes, sir. Please.
Okay. Binoy, you are old friend of mine, and the challenges before you are, bigger than me. Yes, 20 years, we are, 20 years down the lane when the COTPA was enacted, and the rules for smoke-free were, made in 2008. I think that as of now, what we call that a bird in hand is better than 2 in the bush. I am very clear that if we implement the existing provisions of COTPA, for example, simply Section 4, ban on smoking in public places, and then the most, which we, I can say that, we neglected it previously. We focused more on, Section 4. We should be focusing more on Section 6, because Section 6 is easy to implement. The shopkeeper is not going to run away, because smoke-free, one of my articles is also there, smoke-free became popular in India. This is, the term is, it is a meaningless term, smokeless, but it is a popular term in India. It became very popular, and everybody started talking about smoke-free, but it is a misnomer. So, down the lane after 20 years, the impact is not so much Had we gone for ban on smoking in around, ban on sale around 100 yards of education institutes, I think that tobacco would have gone, overall prevalence would have gone below 10% as on today in 20 years. It means that we have not implemented the existing provisions of the Act. Maybe, smoke free partially, and I think below 5 to 10% as far as the 100 yards regulation under Section 6 is concerned. Today, there is a need. We are having tough guidelines. First of all, I will request that please try to implement this Act, whatever provisions are there. Simultaneously, yes, Government of India level, we are going for amendment of the Act. It has to be amended, but it may take next 5 years. It may take, because it is beyond our control. The best thing is implement the existing provisions, and for those provisions, I will say that based on my experience, 2 things. Number 1, don't go for chalaning of individual smokers. Chalan the in charge of the institution, the dhaba malik, the owner of the restaurant. Then the impact will be, much higher. And second thing, chalan the shopkeeper around 100 yards of education institutions, because he is not going to run away like smoker. He's a fixed shop. He will be remaining there. There will be few peddlers, those who will be coming on through cycles, but most of the shops are fixed. I think that more of, rather than waiting for amendment in the Act, whatever is in our hand, we should implement the existing provisions. Thank you. Second was about the funds. What we did in 2009-10 when we devised the strategy for tobacco control, there was a lot of discussion, and the finance department is not agreeing with us till today that the tobacco control fine should go to the treasury. They are saying in clear words. But what we have done, our state level coordination committee has moved a separate case to the finance department in 2009-10 that the tobacco control is not a source of earning to the government. It will, the challan will end if tobacco ends. We should think that if there is no amount which is a challan, then tobacco is not a problem. By this argument, we went to the finance department that don't consider it a source of revenue, then people will sell it more. We are going to wash away this product, and whatever amount, small amount will be there, we will be using for tobacco control, so that a saturation point come when there will be no fine. It means there is no tobacco, and that is our end game target. And I think this is still working, and we are using this. Every year, I think we are collecting around about 1 crore rupees for tobacco for challan, and the most of the challan which is from the tourist people, because they don't know when they are coming that where to smoke, and that is being used for putting those big boards, hoardings, and entire tobacco control activities. I think I could address your questions. Thank you.
Thank you so much, sir. Thank you.
Dr. Gopal, so before asking others, so there's a question about endgame strategy from Dr. Rakesh Gupta, Jaipur. Can you just give your brief comments on endgame tobacco strategy? Basically,
yes,
what
Dr. Rakesh
components
Gupta
you are
is our
taking up?
Guruji, and whatever he has asked, I will try to answer question. I think it is more of my examination rather than asking a question from Dr. Rakesh Gupta.
But it will help others, no?
Certainly, it will help me also. Sir, what happens? Sometimes we work very blindly. As on today, what is happening in India? There are multiple, NGOs, multiple, institutions, those who are working for tobacco control. We know that, our end game target is to, go away with tobacco. They should not be tobacco. What we are lacking, we don't have the clear-cut target, the goals, the indicators. The indicators should be outcome indicators as well as the process indicators. Sometimes we say that, the empower policies are something like process indicators. They are not outcome indicators. They talk about monitor tobacco use and tobacco control policies. But whether tobacco is going down due to monitoring or not, and how much it is going down, that is outcome indicator. In the state, what we have done, we have developed the process indicators in the form of activities, and we have related those with the outcome indicators. That it is our plan that by 2025, tobacco prevalence should be below 10% in the state. And by 2030, it should be below 5%. For that, whatever, when we talk, when we used to take up this matter to the SLC with the experts, they say that how it is going to go down. Then this is the question that what activities we are doing. Yes, we are not doing any, what we call as a very scientific kind of, this regression method, that out of these empower policies, this policy is making much more impact in the state. Yes, definitely we should go for logistic regression, so that we say that M is not working, P is working, O is not working, R is working, what is working? Because it is a, that this is the reason that we are asking the experts from the academic institutions to come and to assess that what is working for tobacco control and what is not working. But as of now, to convince the politicians and to convince the bureaucrats, we are saying that this is the set of activities. The set of activities are based on empower policies, because we presume that we know that we have read in the literature that empower policies are scientific policies. But still, we need to do further study that out of empower, which component of the empower is working more and which is contributing for reducing tobacco use overall. Yes, we are having a approach, we are having a timeline, we are having outcome indicators, but still there is a huge gap and we need help from the scientific fraternity for that.
So thank you, Dr. Gopal. And I may ask Dr. Aruna, Mr. Desh, Dr. Siddhi, Mr. Narendra Pal, if they have very brief comments. Just a minute each. Yeah.
Thanks a lot, sir, for briefing the comprehensive of the tobacco control laws at Himachal Pradesh. A very good model like you have shared. So since Himachal Pradesh is a place of tourist interest, so what was the role of the tourism and development as a stakeholder?
Okay, Arunaji, this is a very painful question because we are still struggling with the tourism department. We are somehow able to convince them that the tourist inflow and the the attendance in the eateries, in the restaurants will increase when there will be a complete smoke-free environment. They welcome that, but many a times they don't want to make some decline in the number of the tourists, especially in the private sectors. The government people, they don't bother about how many are coming, but we are struggling with the partners, and that we are saying that we are doing tobacco control, but Himachal is also a hub for this Malana cream, for this cannabis, which is you can understand that there is a lot of supply and illegal trade and from the state. And this is also a famous destination for the foreigners also. They used to visit those areas in Kullu Valley. Yes, we are struggling. We are trying to find the solutions also. As of now, what we have issued guidelines. We are in constant touch with them. If we are doing frequent raids to the premises, and yes, the positive results are there, but still we are struggling. We don't have a very good solution for this problem as of now, but I think we can address it with passage of time. Thank you.
These places are the hubs for the floating population, so
Certainly.
people, so then the indicators also would vary, like the compliance issues also.
Definitely,
Plus,
this is a problem and we don't have a concrete solution for this as of now.
and so what about the smoking zones at Himachal?
Yes, there was a lot of struggle from secretariat people, especially because most of the IS people, they used to, sit in secretariat that, where should our PA, our, class 4 and our, staff go for smoking. But we did not allow them. As of now, only, I think in Shimla town, there are only 3 smoking zones in the hotel. And rest they are not they are not authorized to do so, because the it is very difficult and to create those negative pressure and no service kind of zone there. But yes, this is a lacuna in the law, and we can't do much if somebody is making those rooms. And yes, enforcement is who enters in the hotel. It is up to the hotel authorities. It rarely happens that once in a month time we visit a single hotel. There are 5,000 hotels. Yes, there are issues, but the issue is more in the legislation, because they will say that it is allowed under the law.
Thanks a lot, sir.
So thank you, Dr. Aruna, and Dr. Rakesh Gupta is with us. Sir, I have asked the question on your behalf regarding the end game, and he has answered it. But still, just very brief comments from your side.
Yes, much appreciate anytime Dr. Gopal Chauhan speaks. He speaks a lot of with a lot of sense, and the effectiveness and impactfulness. What he has done in the country need not I need not reiterate how much useful it has been, and he is one of the leaders in the tobacco control. The achievements have been such in Himachal Pradesh that these definitely require replication by other states. When the other states say that Himachal is a small state compared to ours, I personally don't agree, because if the methodologies have been decided and how to work, I think in whether the state is big or small, the things can be done. So I think Dr. Gopal Chauhan has set the benchmarks very high, and I think those require to be replicated. So that's one submission. You have already asked for tobacco-free generation. Why did I ask you to do that on my behalf? Was because of my engagement here in the secretariat in the meetings. But I also thought of doing so because the Himachal Pradesh has lowest prevalence of tobacco used amongst the youth. So I consider that it is the right platform for taking up tobacco-free generation as the next step. And if Himachal does it, I think that will set the ball rolling for the rest of the country. And all that it requires is to decide on the cutoff date for the children to be born after a particular date, that they will not be sold tobacco products. So it's although an enforcement issue and strategy, which is a supply reduction measure as well, I think it is worth looking into it if it can be done. So I wanted his thoughts on that and maybe mature him on that.
Definitely, sir. Your words are always welcome, and I think these are very good suggestions. We want to take it forward, and definitely I will be in contact with you, in person also, and other colleagues also in WhatsApp group also. That yes, we are also thinking, but as of now, we need your inputs on that so that we can move ahead.
Surely, I'll do that. Thank you.
Thank you, Dr. Rakesh and Dr. Gopal for answering. So now I'll ask Mr. Avdesh, Dr. Siddhi, Mr. Narendra Pal Singh for a very brief 30-second comment, because we are already 4:50, just 2 minutes to go. Thank you.
Sir, it was a wonderful session, highly optimistic, very nicely presented. And sir, I want to say I am from Indore. I have seen the city becoming clean. So at individual level as well as the social public health level, it was very commendable, the work you have done in Himachal as well. Individual person also was included, and the sellers and all. It was good effort and good way of doing it. Very nicely done. Thank you, sir.
Thank you.
Thank you. And Avdeshji and Mr. Narendra Pal, if you have any comments. Mr. Avdesh, are you with us? Mr. Narendra
Yes,
Pal
sir. Yes,
Singh?
sir. Yeah.
Yes,
Yes, sir. This is very presentation of Gopal sir. As always, as a energetic man. No any question. हमारे जैसे राज्य है तो हम बहुत सारा चीज एडॉप्ट करते हैं इनका हिमाचल का.
हम भी अडॉप्ट ही करके पंजाब ने भी बहुत चीजें अडॉप्ट की हैं हिमाचल प्रदेश की, and very successfully we have adopted those.
Yes, sir. Thank you.
So, and Mr. Narendra Pal, if you are with us.
So it should be really replicated all over. It should be.
Yeah, it should be. It should be. So, if I think Narendra Pal Singh not with us, so Dr. Sanchika have.
So can you repeat again? Your voice is not clear.
My voice is.
Yes, sir. Yes, sir. Please.
So आपने ये लिखा है कि I see minimum 50% smoking in public places during my commute to office in Delhi NCR. Any thoughts on this? So recently, Hong Kong people, they have told everyone to stare at the people who are smoking. just to make them aware and just denormalize smoking. I think that is a good, good initiative. But the other thing is that you must report it, and if possible, click the pictures. I mean, you must not make it very. It should not be very open, because people that may be offended. And you can use even the tobacco monitor app. You can upload the photographs and just send your complaints. Or if the state nodal officers like Dr. Gopal Chauhan, so I used to call him directly. So if there's a violation, and he used to send the squad immediately. But not many places you'll get such squads. But I think the Hong Kong model is also replicable, isn't it? And any comments from your side, Dr. Gopal?
Sir, nothing. You have explained it nicely, you know, how it can be done. Thank you.
So thanks a lot, Dr. Pal. If you have any last minute comment, you can just let us know, please.
Thank you, sir. No comments from me, and it was really a nice occasion to interact with all of you. And I'm really thankful for inviting me to join this program. Thank you all.
Okay, thank you. So a formal vote of thanks, Dr. Sanchika, if I may invite. Mr. Rajiv is here. Is Mr. Rajiv with us? Or Mr. Arun Verma? Mr. Arun Verma will do the vote of thanks.
Thank you, Dr. Rakesh. It's an honor for me to convey the vote of thanks, or the proposed vote of thanks, to Dr. Gopal Chauhan Palji, who is an ED and CEO, AIIMS Patna, who has been very kind enough to accept our invitation to be chief guest and deliver the inaugural address. My thanks to Dr. Gopal Chauhan. A lot has been said about him. His presentation is always very highly informative, involving, as well as vibrating also. And you just cannot afford to be away from listening to him. Or he's always very knowledge enhancing also. Thank you, Dr. Gopal Chauhan. Sometimes when I listen to you and I start feeling that why I have been away from this tobacco control program whole of my life until I joined this Sipher. My thanks to Dr. Sonu Goyal, who has found time to be here. Briefly, my thanks to Dr. Rakesh Gupta, who was quite busy, but at the end, he was able to join us. As always, he is very dedicated to these programs. I also thank Dr. Rakesh Gupta, my colleague, who has been always taking initiatives to organize such programs. My thanks to Dr. Sanchika Gupta, who is always half an hour advanced to organize these programs whenever we fix it up. And last but not the least, to all the eminent participants, the audience, and everyone who's been able to find time to join us. I know that the time they have spent on this seminar will never go waste after listening to Gopal Chauhan, because the knowledge he shares is very, very useful for everyone. Thank you once again.
Thank you, sir.
Please about the next webinar.
Yeah. Thank you, sir, for proposing vote of thanks. Now, just a last announcement I wanted to do, that the next session on top is on 26th of July, that is 4 p.m. And the topic is establishing tobacco-free schools in urban slums in Mumbai. And our subject matter expert will be Ms. Sherin Bhutia. So please do join us on next Wednesday at the same time. Thank you for joining us today. Namaste.
Thank you. Namaskar. Thank you, sir.
Namaskar.
Thank you, Dr.
Thank you.
Pal.
Thank you.
Thanks a lot. And thank you, Dr. Gopal.